I'm very grateful to Congresswoman Green for leading this. It is indicative of how high the hill is for us to climb to get the truth out. Dr. Malone, one of my grave concerns is that all of the vaccine injured may not know that they are in the class of the vaccine injured, because people get blood clots and pulmonary embolisms, probably because of the vaccine, but also probably for other reasons as well. And Dr. Abyss, when we look at these tragic consequences of pregnancy, they can at times occur in the absence of vaccine. So what advice would you give us as policymakers to try to really disaggregate the symptoms of vaccine injury and those consequences from those that may have occurred otherwise?
Thank you, Mr. Gates, for your informed question. You are correct in saying that it is an enormous challenge. Just as the virus disease itself largely overlaps with what's called the common cold now in terms of symptoms, and it's very difficult to distinguish. Likewise, these clusters of symptoms are very difficult to distinguish from background noise in some cases. That's the job of the CDC, by the way, is to provide that type of analysis objectively in a nonpartisan fashion. And as even the New York Times has acknowledged, the CDC has become a partisan political operation. So we are left in the absence of reliable data by a federal agency tasked to provide that data to allow the discernment of your question. And the way that this would normally be done is to look for clusters of symptoms that correlate with a known disease or toxicity, and then identify patients who have those clusters. Practicing physicians currently, even those that aren't subject to the many professional and financial disincentives to be open and transparent about these things that you're mentioning, I'm choosing my words, are subjected to an enormous amount of not only propaganda or psyops, as has the entire public been subjected to it, but also enormous numbers of disincentives to disclose adverse events and disclose what might appear to be vaccine-related problems.
I hate to interrupt you, but that should be illegal. It should be illegal if someone is engaged in the practice of medicine or in the highly regulated pharmaceutical industry for people to try to disincentivize access to the information. And it's easy for us to blame the CDC, but frankly, they in a way work for us because we're the ones that authorize the funds for the things that they do and don't do. And so, I think that one of the things we got to work on probably is legislation that directs them to those data, to those clusters, and that then disallows the corrupt activities that you seem to be highlighting.
So, Mr. Gates, I've been advised that technically it is already illegal. These physicians have signed agreements, and their healthcare systems have signed agreements that they are obligated technically to disclose vaccine-related adverse events to the VAERS system. And that disclosure is being actively, let's say, gently disincentivized. There is strong consequences being deployed in medical practices and hospitalist environments to disclosing adverse events, and yet technically it is fraud. They have signed agreements with the federal government that they will disclose these things through the VAERS system. So my understanding from attorneys that are busy practicing in this area, which is a small number, maybe 200 right now in the United States, because that's a whole nother thing, is that a strong case can be made that this does represent medical fraud in the failure to disclose these events. And I'm in touch with some federal investigators who share with me that there's a number of things here in which aspects of this response in which federal employees and agencies have failed to comply with federal law in many aspects, the notorious one being the revolving door, and the two FDA employees that oversaw the Moderna authorization, then immediately left to take six-figure jobs with Moderna. But there's many examples of what appears to have been fraud or law breaking occurring within the federal administrative state that is not, these individuals are not being held accountable because there aren't the oversight structures, ombudsman, or other processes to enforce the law.
Yeah, even when we catch them. By the way, I'm holding the Inspector General report from DOD where the Inspector General said that there was not the itemized review of people's religious exemptions that the law requires. So if we're going to keep funding it, it's going to keep happening. And I think the message to us is that we have to use the power of the purse. I don't have any other questions, but if Dr. Biss, if you had anything to contribute regarding how to kind of disaggregate these symptoms, I'd love to hear your perspective before you.
Well, I would love to give you an example that just happened to me this week that kind of shows what's happening down in the trenches with the physicians. I had a patient come see me. She's 47, healthy, because her husband works as a civilian in a military base in Germany. She had to get to Moderna, and then when she came back to the States, she had to get a booster. She had Pfizer, so she had 3 shots in aggregate. Her last injection was in January of 2022. So it's been a while. For some reason, with no antecedent event, she didn't break a limb, she didn't have surgery, she wasn't sitting on a plane for 12 hours, she developed bilateral lower extremity blood clots, one of which broke off and caused a pulmonary embolism. She survived, but she was in the hospital for quite some time, had a huge workup. So bottom line is she has 5 specialists now on her case for all her problems. She comes to see me for her annual exam. And she's telling me this story, and I said to her, did you get any of these messenger RNA injections? And she looked at me and she said, you're the first doctor that's ever asked me that. ER physician, hematologist, rheumatologist, I don't know who else is on her case. I'm just an OBGYN. I can't help her with any of her problems. I said, well, you need to go to the hematologist, and this is what this hematologist needs to order on you, please. But this is what we're up against. They're not asking the question. So how are you gonna tabulate any of this? Nobody's connecting the dots.
I would just finally observe, we're only aware of the vaccine injuries where essentially people are so hyper aware of the connection between these things that they almost self-identify because we have this infrastructure that disincentivizes it. And we fund this system. It is federal money that funds healthcare in this country, and we simply should not tolerate that. Thank you so much for filling this leadership vacuum. I yield back.
Thank you, Congressman Gates. Well, here in the shadow Congress, we do talk about the VAERS reports, and these are the numbers. And so these are the numbers of patients, doctors, clinics, hospitals that have reported to the system that we do indeed fund here in Congress. And there should be accountability and there should be transparency. And every single one of these victims deserve their story to be heard and their cases to be investigated and asked if they have been vaccinated. So I completely agree with that.